Hey world, I'm Nick.
I'm Amber.
And together we are Functional Movement Therapy. We're both doctors of physical therapy, and we are here today to talk to you about radiculopathy.
So you also may know this as sciatica, piriformis syndrome, or even a pinched nerve. I'm sure you have heard these terms and possibly have dealt with it yourself.
Over and over again, right? So we are going to help you start to improve that pain, start to move better, and most importantly, get a better night's rest.
Yeah, so if you haven't, please refer to our first video on low back pain caused by reduced core stability. It will give you a little bit insight leading into this video, and we hope to help.
Absolutely. So don't forget to hit the like, hit subscribe, do all the things, follow us on social media, and we will see you soon. Take care.
Been scrolling through your Facebook newsfeed and you see an article pop up, 3 easy steps to abolish your sciatica. Okay, most of us have, right? Now, how many of you have tried those 3 easy steps and have been unsuccessful? I'm sure most of you.
So today's video, we want to help you improve the mobility after your injury, decrease your pain, and get a better night's sleep. Radiculopathy is a very complex diagnosis, and so we really recommend that if you've been in pain for more than 2 weeks, you're finding that the pain is going from the lower back to the hip and starting to go down towards the knee, and in essence getting worse and going further down the leg, you find a specialist.
And where can we find a specialist?
All right, so we wanted to take a moment to really define what radiculopathy truly is. Because I hear often in the clinic, oh, I have sciatica or I have this pinched nerve, and then it runs to the front of my hip, down the outside of my thigh, or deep into the hip socket. Those things aren't true radiculopathy. It's not true sciatica. And so what we've done here with our lovely model is to lay out the pathway of the nerve as best we can in 5 minutes with a piece of string. Okay, bear with us. But this pinched nerve here is going to go from the lower back down to the outside of the back hip, right in the center of the glute, down the back side of the leg, and it's either going to go straight down to the calf and foot, or it could wrap around the front of the outside of the shin a little bit to go towards that pinky toe. So that's your typical pathway of radicular pain. So Amber, if I think that I have radiculopathy, what's it going to present like?
So you can either have an acute case of this where you may have a little bit of low back pain, but then you do an aggravating move, you twist, you step off a curb, it could be something very little, and you experience this very sharp pain that actually goes from your low back and goes down the leg, just kind of like we showed.
One of those moments where you know you hurt yourself. It's going to be something like that, and then you know you're in trouble.
Yeah, or you could also have chronic low back pain for a long period of time and then start to gradually feel this tingling and numbness going down the leg. As it goes further down, that is the worst that it is.
Right. If it's going below the knee, you're in trouble. Seek a specialist.
Yeah, so what you also may notice once this progresses even further is that your muscles in that posterior leg actually start to get weaker, okay? Because this nerve is being pinched off that is innervating these muscles.
Right. It's like the garden hose, right? You pinch off the garden hose, you're not going to get the flow of water. Same thing with the electrical signal from the nerve. Is you need that nerve to breathe and have all the capabilities, blood flow, oxygen, etc., that help it to do its job.
Yeah, and even further, if you might even have this loss of sensation because of this tingling and numbness that's happening, people will often say, I feel like my whole leg is asleep. I can't feel touch. I can't feel temperature. That's when we know something has progressed to the point that you need to seek help.
Right. And these things are important because this is going to help us determine what movements help you to move better versus worse. We want the pain to now go from where it was going down now to go back up the leg and to the lower back.
Okay. What we want to do next is actually find your direction of preference. So we want to find those movements that's actually helping to move that pain back up the leg into the back. it's very essential that you not only feel better, but you are actually experiencing the movement of the pain or the tingling and numbness.
Absolutely. So most of the time, that direction of preference is going to be a forward or backwards movement, okay? Probably about 80% of the time, I'd say, in the clinic that we can find a direction forward or backwards, and then it's a matter of identifying how much force we need to use.
Okay, so we're going to ask you, do you feel better with flexion-based exercises, which tend to be sitting, bringing your knees to chest, as in you're curling up in a ball, and bending?
Right. Or extension-based exercises, being it standing, walking, and laying on your stomach.
Yeah, so from there, whatever movement actually feels good for you, it's quite simple. That is the movement that you are going to do for your exercise.
Absolutely. Couple that with a little bit of ice and anti-inflammatories to help some of that swelling and discomfort. You've got yourself a nice recipe.
Now that you have determined your directional preference, whether bending down and flexing the spine had helped you to feel better or extending the spine backward had felt better, we want to show you 2 different exercises that we generally give our patients to assist with that pain management.
Right. Before you do any exercises, make sure to take note of where your pain is and what your numbness and tingling or discomfort is like, okay? Because improvements in this discomfort is going to be pain moving up the leg and going towards the lower back, decreased in numbness or tingling, and improvement in range of motion. Any of those 3 things counts.
Okay, so for the sake of the video, Nick, I'm going to say that starting here, my pain, my tingling and numbness is coming from the low back and it's going all the way down into the back of my knee.
Okay, perfect. Okay. So what we're going to start with is prone on elbows with the pillow. We start with the pillow because it's a little bit less extension on the lower back. It just makes the position a little more tolerated. As you progress, you can always take away that pillow. But we're going to stay in this position for about 2 to 5 minutes and just kind of breathing into that area and giving yourself some good oxygen, okay? Okay, now as we're assessing how the pain is responding to different directions of movement, if during prone on elbows your pain has started to move up, the range of motion is improving, and the numbness and tingling is getting better, then you can progress to the press up, okay? And
green light.
Green light. And we're going to use this green light, red light analogy for what is better and what is worse. It's as black and white as medicine can be. So for the press up, Amber is going to use her hands and use her arms to press through the lower back and the middle back while relaxing her neck. She's only going to press up to the point of stretch in the lower back and not push into pain. So taking this nice and slow and steady, and we're going to do our repetitions of 5 to 10, and then resting in between our sets and doing a couple sets at a time if tolerated, okay? And then when she stands, again, reassessing where the pain is and how things have changed.
So if you still have the green light at this point, your pain is moving back up the leg, everything's feeling better, then we want to continue with that extension or bending back of the back. That will be your direction of preference. You have determined that your direction of preference is flexion of the spine, and the activities such as bending, sitting, or even being curled up in a ball actually help your pain. Then we are going to show you this next exercise. Also, if we had a red light scenario with the extension, those press-ups of the back in which our pain moved further down into the foot, then this is the exercise that's going to be for you.
Okay, so for our flexion-based exercises, our favorite is a double knee to chest. And so what we're going to do, Amber's got her cardigan here to help us, and you can do just hands to knees, but what we find easiest is to use the towel or use your cardigan to bring both knees towards your chest to feel a stretch in the lower back and then release to the length of the arms. Again, you're going to hold for 1 or 2 seconds. Feel a little bit of stretch. Try not to hold your breath. Continue to breathe. Exhale as you're pulling those knees up. Inhale as your knees are all the way back down. And then return to neutral. Again, we're going to do our sets of 5 to 10 repetitions, 2 to 3 sets at a time. and assess our pain, numbness, tingling, neural tension afterwards.
So after that needed chest exercise, if you experience a green light and again your symptoms are moving back up toward the back, then we would continue. Nick said, 2 sets of 10, continue as long as it's still traveling up. If we have a red light scenario in which the pain is going down the leg, we would want to stop this exercise.
Perfect. With any of these red light or green light scenarios, with the green light scenario specifically, it's really important to note that pain can be worse in the lower back, but if symptoms are traveling up the leg, still a green light. Mm-hmm. Now for the moment we've all been waiting for. Let's talk about sleep.
What's that?
Amber and I have a newborn, so we don't really know what that is anymore.
Haven't slept in weeks.
So when talking about sleep, we find that most of you sleep in one of 3 positions. Either on your stomach, on your back, or on your side when you do sleep. So let's start on our side, Amber. To sleep properly, we want to help you to maintain spinal neutral. That is going to be what helps you to recover the best, because when you're sleeping, that is a prolonged amount of stretch on the spine or any tissue, regardless of what you're trying to heal. So notice that when Amber is sleeping right now, we've added the pillow in between the knees, okay? And so what that's going to do, especially for females, but for males as well, is to open up the hips, which decreases the tension and the stretch on the back side of the hip, okay? So again, improving that lower back spinal neutral. What you also may want to do is add a pillow even under that top arm to get the thoracic spine to rotate backwards lightly. There you go. So that even the middle of the back is in good alignment. Next, we're going to go to sleeping on your back. And so if you're going to sleep on your back, we have to maintain the lower back curvature. And so what we'll do is add a pillow either under the knees, right there. And it may be 1 pillow, it may be 2 pillows, but you want to at least support that lower back curvature. Okay? That's number 2. Number 3 is sleeping on the stomach, okay? And during this time, you're probably not going to have very much comfort in sleeping on your stomach. But if you do, you can add either a pillow under the hips, just like the prone on elbows, or we can add that pillow under the shins as you progress and get better. Nice and smooth. There you go. Pretty close. And so I would scoot that pillow down a little bit further to have a little bit more comfort, right? It's a hard position.
Sorry, Nick. No sleep. So we hope this video has helped you. If you have any questions, please come see us at the website, functionalmovementtherapy.com. And please comment below and let us know your direction of preference, whether it is flexion or extension of the spine that has helped you.
Absolutely. We hope that this video helped you to improve your pain, improve your mobility, and most of all, getting a better night's sleep.
Cheers to that. Until next time.